Hi everyone, particularly my loyal subscribers and those of you who are joining us or visiting this channel for the first time. Let me just extend to you a very warm welcome. Thanks for doing that. We appreciate you. Now, in the last video I spoke about the need for wearing masks. And as expected, things have gotten so much worse. Now, today I'm going to be talking about giving some love to our coronavirus COVID-19 patient frontline workers who have been undergoing tremendous physical fatigue and emotional trauma. I'll be right back. Welcome back to my YouTube channel. My name is Dr. D. Terrence Foster. If this is the first time you're joining us, let me just welcome you wherever you are in the world. It's indeed a pleasure to have you. Now, the physical fatigue and emotional trauma of coronavirus COVID-19 on frontline workers is extremely difficult to cope with and continue to be exponentially worse every day. We have been fighting the disease of coronavirus COVID-19, which for the most part was preventable. Now, in the United States, on this Friday that just passed, Friday the 28th of November 2020, over 200,000 people were tested positive and over 2,000 people died from coronavirus. Now, if you compare that statistic to the second worst country with coronavirus, which is India, India has a population of about 4 times the population of the United States, which has a population of about 330 million people. Now, however, India has 1/4 of the number of coronavirus cases per day, and they also, in terms of economic ability to deal with their citizens, India's gross domestic product per capita is about $2,000, while that of the United States is about $60,000. So you could see the significant disparity in terms of economic wealth, or the difference in economic sustainability and ability to take care of its citizens. United States is by far much more capable of doing that. However, when it comes to coronavirus, we're just not doing a very good job. Now, United States is not the only place in the world that is having problem with coronavirus, but we're by far the worst in terms of dealing with coronavirus, as the number shows. There's so much more that can be done. And of course, as I mentioned before, one of the fundamental things about this is wearing a mask. Now, the numbers that I spoke about, over 200 people being infected, over 2,000 people dying each day, is significant and is getting worse. Now, let me just take you back to a time when I used to work in acute hospital on a consistent basis. I used to be the medical director of an acute inpatient rehabilitation, and I did that for about 10 years. And what that means is that I would admit patients who are acutely ill to a medical unit, which is a rehabilitation unit. And those patients, they'll be coming from the intensive care unit, they'll be coming from the hospital that I was working in, as well as from other hospitals in the metro area close to the hospital. Now, I did that for 10 years, and in 10 years, I can recall 3 people that died on that unit. 1, 2, 3. Now, the first patient that died was a gentleman. He was about mid to late 70s, and he had significant comorbidity. He had end-stage renal disease. He was an amputee, a below-knee amputation. He had heart disease. He had diabetes. He had so many comorbidities. And he was on our unit for about a week and a half. And then one day he just died. And that was the first one. The second one was another gentleman who was transferred from another hospital to our facility. And he came in the evening, we saw him, I admitted him, and he died about 4 hours later that evening. We weren't able to get an autopsy because the family didn't want to have an autopsy. Now, that's the second one. The third person that died on the unit was a young lady who had some complication related to postpartum. She had given birth to a child and it became very ill after that and was admitted to the intensive care unit for a long period of time. She came to our unit and died the following morning after she was admitted. Now, those were the 3 cases. Now, I can tell you that those 3 cases were very difficult for us during that time. And we believe at that time that we were really going through some very emotional and difficult time in just dealing with those people. Even though they weren't happening at the same time, this is spread over the 10 years that I was the medical director. So we went through the grieving process. We grieved, we consoled each other, and we got through it. Now, fast forward to 2020. Now, when you are an healthcare provider and you are literally having someone dying on your unit in your care every day, and sometimes multiple people dying, you leave your shift and you leave people alive and you come back and a significant number of them have died. That is not what or why we go into medicine. We did not go into medicine to see people die in front of us and feel helpless and powerless where we can't do anything. And that is in part why this is so traumatic and so difficult for healthcare workers to deal with. That's not what we are used to. That is not what we expect. When we treat patients, when we take care of patients, our hope and our desire is to see them walk out of our unit, walk out of the hospital, and go home to their family. And we feel good about that. That's what gives us the drive. That's what gives us the courage and the desire to want to do what we do, because we care about people, we care about patients, and we want to see them well. And once we see them just dying in front of us where we're feeling helpless, then that, my friend, is not a good feeling. It is a horrible feeling. And, for those of us who have worked in healthcare and have 1 or 2 people died or a few people died, we know the trauma of it. And some of us can remember people who have died under our care. Albeit it may be very few, but we can remember. That is part of the emotional trauma that healthcare providers are going through right now. Then you add to that the physical nature of it, where wearing the protective equipment is in of itself a chore, because you have to change those from room to room. In a lot of cases, you have to just deal with the cumbersome nature of doing that. That in of itself is physically draining. It's physically draining to having to do that time after time, every time. So it is hard. The other thing that adds to that is there are less and less people available to do the work, because people get sick. Some people are afraid. Some people are just out because they're tired. They want a break. They want to stay away from it for a while to literally just recharge. So that makes it even more difficult for those that are still there doing it. So when I say give the healthcare workers some love, I want you to think about that. Think about the emotional trauma. Think about the physical trauma. And there's more, but just think about those two. And those are just some of the things that are quite obvious. The exhaustion, the emotional drain that is there, it's indeed very, very traumatic just to deal with all of that. And that's some of the reason. But one other thing that I want you to also consider when you think of healthcare workers and frontline workers, do not just think of doctors and nurses. Think of also of the therapists, the respiratory therapists. Think about the physical therapists, occupational therapists, or speech therapists, or speech language pathologists, who are there having to work with some of these patients all the time. And a lot of times, when you compare the amount of time that doctors and nurses spend with patients, those other providers are spending a lot more time with them. And also, not just the therapist, but also think about the nurse's aide, the people who have to spend most of their time in the patient room, cleaning them, taking care of their hygiene, taking care of their dressing, making sure that they're appropriately clean and that their needs are met. Think about the people who have to do the cleaning of the room, the cleaning of the machines, the cleaning of those ventilators. Somebody has to clean them, get them ready to be used again. Somebody has to go into that room and take out all those garbage and take out all those things that have been infected. Somebody has to do that. And who do you think do it? Sometimes is someone who may not have, have mastered all the training and all the skill need to do that. So therefore they're at extreme risk, or more risk than, say, someone who probably have a better grasp of what they're going through or what is required. So think about all these people that have to go through and deal with all the challenges of the coronavirus. So when you think about not wearing your mask or not doing this, make sure that you could allow yourself to think about the challenges of not just doctors, nurses, therapists, staff that are there that have to work with all the challenges that are there. The people who have to clean those rooms after the patient have been removed from those rooms or after the patient have expired. The people who have to take these garments and then dispose of them or to take them to the appropriate place. These people are at extreme risk of exposure, and they are putting their life on the line every step of the way. So it's not just about, as I said, about doctors and nurses, but it's about a whole slew of people. There are just so many people who are involved in this. So when you think of the idea of, well, oh, I don't wear a mask because of whatever, just realize that you're not just doing it for yourself, or you're not protecting just doctor, you're protecting everyone, and you're saving lives. You're doing something that is indeed beneficial. So I want you to bear that in mind the next time you decide, oh, you don't feel like wearing your mask. So when you think of not wearing masks, think about all the other people that are there, not just doctors and nurses, but all the other service workers that are there, which are called frontline workers. They're there and they're spending so much time. And then they have to leave from there and go home to their family. Just as the doctors and nurses, they also have a family. They also have to go home to their families as well. So think about them. And when you decide that you don't feel like wearing a mask, or you don't feel like it has anything to do with you, for one moment, think of other people, because you can make a difference. You could be of help to the situation. And rather than just say, you know what, I don't care and it doesn't affect me, but you can make a difference, and that's what's important. So I want you to know that, and I want you to be a part of the solution. It is not easy when you're working on a shift and your most frequently requested item is body bag to put the remains of your patient. It is just sometimes too much to bear just to go through that. It's not easy when you leave work and you come back the next time for your shift. The person that you were taking care is no longer there. They're dead. It is not easy. So, think of those things and understand the emotional drain that puts all the staff members that are taking care of these patients. Because that's not what we go into this for. It's not. So think about those things. And when you're asked to wear your mask, remember that for the most part, you're going to be wearing that for a very short time. You're going to be wearing it when you're in the presence of others. That allows you to protect yourself and also protect them, so that you're not passing on the virus to someone who is not infected. Now, of course, if you're alone in your car, there's no need for you to wear your mask unless you're going to be in contact with someone else. If you're home, then generally you're not expected to be wearing a mask unless you've been exposed, or you think you may be exposed, or you have some elderly person or someone who has significant comorbidities that you're concerned with. Then even if it's your relatives and you're there, and sometimes it's still a good idea to wear your mask in your home. Otherwise, if everyone in the home is fine, everyone in the home is healthy, and there's no chance of anyone there, or there's less chance of someone there having coronavirus, then of course it's okay to not be wearing your mask in your home. Once you're home, it should be a fair risk for everybody. So at that point, unless there's someone again who is at extreme risk that you're protecting, then there should be no need for you to be wearing a mask at home. Which means that in general, you're going to be wearing a mask to a very limited extent. So bear that in mind and be very cognizant of other people's risks and be aware of the benefit you could do in helping others in accomplishing, all of us trying to reduce the risk of this virus spreading and causing the amount of problem and the amount of debt, and of course the secondary effects, of course, is the economic impact which is having on just about everyone. Now, some of you may be wondering, where is Dr. Foster's weekly video that he claimed he's going to be producing every week? Now, what's been happening is that I've been overwhelmed with a lot of good things, and I'm going to be taking some time off to complete some project that needs to be done in a timely manner. So I will not be producing any video for a short time, and I'll be back in 2021, in January 2021, to produce some great video, great content. But in the meantime, what I'm going to ask you to do, since there's quite a bit of video here so far, is to make sure that you take time and look at these videos, comment on them, give me some feedback, ask questions. I'm looking forward to responding to those questions. I won't be that busy enough that I won't be able to respond to those questions. But to produce each of these videos does take time for each video. And I am in the process of what I call constant improvement. My hope is that each video that I produce is better than the last one. That is what I'm striving to do. So I know I'm going to need more time to produce videos and to do some of the things that I have to do. So for that reason, I'm taking a break, but I'll be back in 2021. So I look forward to seeing you then. And in the meantime, as I said, make sure that you be engaged with this channel. And I'm coming back. I'm not leaving you. I also encourage you to like, share, and subscribe to this channel. And when you do subscribe, make sure you hit that notification bell so you'll be notified each time a new video is released. Finally, as always, let us all remember, each of us should strive to keep a healthy mind and body. Thank you so much for watching.